It's a general fact that biomedical engineers are the gurus behind manufacturing of so many equipment in the hospital. But in some cases, they might not get authorization to operate those kind of machines. The gurus behind the operation of such kind of high-tech machines are radiographers, the gurus of electromagnetic radiation. May I have the pleasure to invite Al-Mustafa Abubakar Amanawa to be on stage and tell us more about radiology?
All protocols duly observed. It's mandatory to give honor to whom the honor is given due to. All praises and thanks are due to Allah, the Almighty, the most beneficent, the omnipresence. May His peace, blessings be upon His noble Prophet, Prophet Muhammad sallallahu alaihi wasallam, till the day of resurrection. It is an honor to be here today to get to partake in an event like this, which means so much to everyone in this room. In many ways, today represents the beginning of a new journey for us all. Not just of the mountains of papers and fees or the thousands of miles we have traveled to get here. Today also represents a day we will let the world know about the roles we played as paramedics in healthcare system. We have completed a major milestone, but this is only one stop part of our journey as paramedics. I'm delighted to experience this with you all, and congratulations. Standing before you today is Abubakar Mustafa Amanawa, a final year student from Department of Radio Imaging and Diagnostic Technology, to talk about the role of the warriors with invisible weapons, those whose mission is outlining an invisible medical disorder, those whose troops have specialty that are ready to fight at any point. The band of warriors who are trained to take shots at every point. The only revealers of disease hideouts because they capture at all points. The only ones who provide cancer treatment. These are none but the radiographers. Radiography is the limelight of modern medical practices. Over the years, medicine has gone through a lot of revolutions, mind-blowing discoveries, and jaw-dropping inventions. However, none can be compared to the game-changing discovery of X-rays by a German physicist, Professor William Conrad Röntgen, on November 8, 1895. Röntgen's discovery doesn't only earn him a Nobel Prize in physics, but also marked a great milestone in medicine. Since its discovery, X-rays have been used in many fields, more outstandingly in medical practices. It has brought about precision in medical diagnosis, plays vital therapeutic roles, and has vast interventional applications. It made it possible to look at the human body from within without having to cut it open. Radiographers are the internationally recognized custodians of X-rays. They are trained professionals who utilize ionizing and non-ionizing radiations who utilizes ionizing and non-ionizing radiation for diagnostic, therapeutic, and interventional purposes. Röntgen's discovery paved way for many incredible discoveries in medical imaging. Radiography is no longer limited to the traditional method of image acquisition using X-rays and image receptors. It has skyrocketed to the application of many other ionizing and non-ionizing radiation for medical uses. It involves the use of fancy yet sophisticated machines like the magnetic resonance machine, MRI, computed tomography, that is the CT scan, the computed axial tomography, CAT, gamma cameras, ultrasound, PET scanner, SPECT scanners, and many more. Regarded as the eye of medicine, radiography today is necessity in every healthcare facility. It is like the light that is needed to guide the doctor down the dark street of medical diagnosis and treatment. Today, radiographers are involved in almost every step of patient care in the hospital. They are at the forefront of medical diagnosis and treatment. They help assess patient well-being, diagnose all sorts of conditions affecting the internal organ. They assess the well-being of a pregnant lady and her child. Sometimes even tell the baby's gender. Cool, right? With the help of radiographers, all forms of cancers can be treated and can be detected and treated. In the case of malignants, that is the untreatable ones, the radiographers help assess its margin for a more precise surgical removal. They said, and I quote, neither the doctor, nor the pharmacist, nor the physiotherapist, nor the biotechnologist, nor the lab technologist, nor the biomedical engineer, nor the nurse, nor the dentist, nor the ophthalmologist that treats cancer, but rather the radiographers. They are the big role players in patients' surgical journey. Radiography as a field is vast and fast growing. It is arguably the fastest growing profession, with lots and lots of cooler inventions. Aimed to further simplify medical practices, radiographers are undoubtedly an integral part of medical team whose role cannot in any way be overemphasized. The radiographers also operate mammography machine for breast imaging to detect early cancer, fluoroscopy machine for real-time X-ray to see the real-life situations in the body. Radiographer who specialize in nuclear medicine carry out both diagnostic and therapeutic procedures using scintigraphy, thermography, DEXA machine, PET scanner, SPECT scanner. Radiographers also carry out some special investigation like the HSG test, that is the hysterosalpingography, to outline the internal shape of the uterus and see if the fallopian tubes are blocked. Also, there are some special investigations like barium enema, barium swallow, BMFT, IBP, IBU, sinogram, fistogram, xylography, laryngography, among many others. And they also provide a treatment in some of these special investigations. Medical imaging is the oracle of medicine, with which the impression of physician can be confirmed or refuted. At this juncture, I remember of a day when a patient was sent to our radiology department. To the assumption of the doctor, the patient swallowed a coin, but once we exposed the patient, we observed that there was no any coin, with which if there were no radiographers, the doctor have to cut the patient. But with the radiographers, it has limited the cutting. We just X-ray, we just expose him and understand that it is not a coin. Medical, and by the way, the presence of a radiographer minimizes the risk from cancer if you are exposed to ionizing radiation. Don't subject yourself to imaging without being sure a radiographer is available. Whoever is there, if he is not a radiographer, don't subject yourself to imaging modalities because he has nothing to do there. Lastly, permit me to call the attention of the general public that not everyone out there who is operating radiological equipment is a radiographer. There are quacks everywhere. As a patient or relation to one, it is your right to be sure that you are being attended by appropriate personnel. If they do not have a name tags and their profession clearly emblazoned on their gowns, please ask questions to be sure to be safe. Thank you. I am Al Mustafa Amana by name.